Welcome back to another episode of Skinfluence. I'm your host, Dr. Dustin Portela, board-certified dermatologist.
And I'm Austin. I'm a physician assistant here at Dr. Portela's practice.
And today we're going to be talking about teen skin. Teenagers make up a huge complement of our practice and most dermatology practices. And their skin is a little bit different than adults or babies. There's so many changes happening, not only to the body, but to the skin. More oil production, acne is much more common. And we're going to be covering a whole bunch of that stuff today.
Yeah, we see quite a large population of our patients are teenagers coming in, struggling with their skin. So I'm happy to be able to talk about something like this today and try to give some clarity and help people achieve clear skin.
Yeah, and starting off the bat, your skin doesn't define your worth as an individual. I know I say this a lot, but that's important. There are genetic factors and things where sometimes your skin is just going to misbehave and it can strike at your confidence. But the reality is you are valuable no matter what your skin looks like, and you deserve to be treated well with love and respect by your family, by your friends, by your peers, by teachers, everybody. So I want to get that kind of out into the ether before we talk about anything else, because we will be talking about ways to improve your skin, but that doesn't make you a better person if you have clear skin.
Totally. And no matter what other people are saying about you or about your skin, like Dr. Portela was saying, you do carry intrinsic value. You are valuable no matter what you look like. And even though there is an ideal look, just because you may not fit that mold doesn't mean that what's on the inside isn't as important, if not more. So.
Yeah. Instagram versus reality.
Yeah.
Don't fall for filters as being the ideal standard.
Oh yeah. Filters they've caused some damage.
Super big damage. So, well, let's talk about understanding teen skin.
Yeah.
Why do teenagers go through so many different skin problems?
Well, a lot of it has to do with, as we hit the teenage years, we start producing hormones, and those hormones play a huge role on our skin. Especially the oil glands will start opening up. You're producing a lot more oils, sweats, and that leads to a whole host of different conditions. But the worst of it really being severe, like nodulocystic acne. But we hit that puberty phase, and a lot of people don't think that the inside of our body has much to do with the outside of our skin, but those teenage years are a perfect reflection that what goes on internally can reflect on the outside.
Yeah. So I think acne is a good place to start. The increase in hormones that happens in adolescence with puberty, as they go through puberty, there's a huge boost in testosterone. Obviously, females will start having their cycle where there's changes and fluctuations in estrogen and progesterone, and that can play a role in the skin. But also, even females will have an increase in testosterone. Obviously, boys also have a marked increase in testosterone. And our oil glands in the skin have testosterone receptors. And that's what triggers them to actually start growing and producing more oil. Our oil glands and our apocrine sweat glands are not terribly active until we go through puberty.
Yeah.
So we see sometimes neonates, like new babies, that get acne, and that's an influence from the mother's hormones that they still had in their system.
Yeah.
And infantile acne often fades over the first few weeks of life as the hormone levels go back down and the mother's hormones get out of the baby. But when you start producing your own, your oil glands wake up, your apocrine sweat glands, those are the ones in your armpits and in your groin and everything. And so they become much more active and problems can start to emerge.
Yeah. A lot of times that's why we start to smell our sweat more. We get that bacteria buildup eating away the sweat and that builds up in our body folds, and we start to need deodorant and all of that. So are there different types of acne that we see in the teenagers versus adults?
In many cases, people will go through a cascade of acne, starting with comedonal acne. That's your whiteheads and your blackheads. The oil glands are just starting to wake up. They're producing more oil. You get a little inflammation in the skin for a host of different reasons, and you're going to get those pores plugged up and get whiteheads and blackheads. They don't have a lot of inflammation. They're not actually producing pus. It's just keratin and oil. They can be expressed pretty easily in the dermatology office. Don't pick your pimples. And then some people will then mature into papulopustular acne, a little bit more inflammation, some pus, and some people will then go on to develop nodulocystic acne, which are deep, painful cysts that increase the risk of scarring.
Right.
But you don't have to go through that cascade.
Yeah. You can stop it early.
You can stop it early. Or some people just start with cystic acne.
Oh, yeah.
They don't really go through the comedonal phase or the inflammatory phase. They just start right out with bad nodular cystic acne. And a lot of times there's a strong family history for that. And so they're more likely to get it.
Yeah, yeah. Are there certain mistakes that you see teenagers make once they start to get acne that's causing it to flare up or get worse?
I can speak for myself
Yeah.
because I'm not in the bathroom with other teenagers seeing what they're doing as mistakes. One mistake is people just turn to TikTok. I didn't have TikTok when I was growing up.
Yeah, neither did I.
But nowadays people are turning to TikTok and trying to find all these hacks. So they're putting toothpaste on their pimples. They're making masks at home out of lemon juice and all sorts of crazy things. If it's in your pantry, it's for eating. It's not for your skin.
Wait. So you're not supposed to eat your skincare?
You're not supposed to eat your skincare, whether it's beef tallow or toothpaste or whatever. Don't eat your skincare.
Yeah.
So people are turning to social media and getting bad advice. That's a big mistake.
Yeah.
For myself, I just kind of didn't talk about it with my parents. Obviously, like they saw that I was getting acne, but I wasn't proactive in like, how can I make this better? I didn't know that there was lots of options available out there. I never asked to go see a dermatologist for my acne.
Yeah.
And so you have to just be willing to talk to your parents about, hey, I would like to get a better hold of this. What can we do? What can be done?
Yeah, that's great advice.
And if you can't get to a dermatologist, find a dermatologist online who's talking about acne. Don't just go to some random influencer and try to get advice from them. Just because somebody else has good skin doesn't mean their routine is going to be right for you.
Yeah, that's a big thing that I think growing up, I just relied on what my peers were doing, but everyone's skin is a little bit different.
Yeah.
And so what helps somebody else may not help you or me. And so just doing what the crowd is doing may not be the best option. Another issue that I see in teenagers is they like to pop the pimples.
Yeah.
And it's tempting and it can be satisfying at times. But the issue with popping is if you pop the same pimple over and over and over again, you can induce scarring. And now you have a scar and it can last forever sometimes. So I typically tell my patients if they have a pimple that's just ready to go, it's angry, there's a big whitehead, evacuate it, okay? Just get that pus out and then leave it alone.
Yeah. Wash your hands first.
Wash your hands.
Give it one good
hygiene.
attempt, but don't keep mashing on it if it's not coming out easily.
Yep.
Throw a pimple patch on there and leave it alone.
Yeah.
So,
and then another thing that I've seen is teenagers tend to feel like being really aggressive is better.
Yeah.
If I really rub my face, if I'm scrubbing it, I'm getting the dirt out that you're accumulating during the day or during sports or things like that, and that tends to aggravate everything.
Yeah. I destroyed my skin barrier in high school.
Yeah, we all did.
A lot of college. I did a whole YouTube video on recreating my teenage routine, and using those products nowadays, I can't believe I use that stuff every day for years.
Yeah.
So,
leaving your skin nice and tight. You just think that feels so good, but it's just tearing apart your barrier.
I didn't know any better.
Yeah.
People have way more resources now.
It's true.
So another thing you mentioned already is body odor, much more common in teenagers.
Yep.
So your apocrine glands, we have different types of sweat glands. Sebaceous glands, the oil glands are a type of sweat gland. They're a type of gland that comes out to the skin that produces oil. The apocrine glands are in the armpits and in the groin area, and that's the material that they produce feeds bacteria that can then lead to odor on the skin. And so teenagers are going to start to use antiperspirants or deodorants. If you're using an antiperspirant, it's best to use that at nighttime.
Yep.
When your skin is dry, it's actually going to work better because if you go to bed after putting on the antiperspirant, you're not in a period where you're sweating a whole bunch. It actually can get into the sweat glands and stop the sweat better than just using it in the morning.
Yeah. I think that's a common misconception, and I think that's a good point. Another thing that we see often is dandruff.
Yeah.
So we're producing more oils. That oil spills out onto our scalp, and along with it, sometimes a yeast that lives in our oil glands can spill out and cause our skin to get, especially on our scalp, to get flaky and itchy. And we start buying Head and Shoulders, and we start going to the store and trying to find different shampoos, when oftentimes, again, talking to your parents about it, and your parents will often bring you to the dermatology provider, and we have treatments for dandruff or a condition we call seborrheic dermatitis, which we've talked about in the past.
Yeah, we have. We've covered that. this is the time when people start to get much more concerned about their appearance. And so they're starting to use more hair products. And when you start putting tons of stuff on your scalp, you start getting scalp oils and all these different things. You can increase your risk for eczema on the scalp or for seborrheic dermatitis. Also, a lot of girls are now getting into makeup around this time.
Yeah.
And this temptation to put on lots and lots of makeup, again, maybe pursuing that Instagram filter ideal. But when you're caking on a lot of makeup, that might increase your risk for acne. So these are just common things that teenagers do, sometimes in an effort to fit in, bowing to peer pressure, following the trends, and it can have bad effects and downstream problems to the skin.
Totally. One of my probably biggest travesties was I doused myself in Axe.
Yeah? You were one of those?
An Axe kid. I probably went through so many cans of that.
Axe body spray. I forgot about that stuff.
You never got into Axe?
Into it? No, I never did. I think I used it every once in a while. So my dad was a school teacher.
Yeah.
And at the end of the school year, I don't know if this is like, we would go into the school because kids, like, they've checked out. And so we'd go into the locker room, and that's where I'd get things like Axe body spray that people left behind. Yeah. I didn't use somebody else's like old deodorant, I promise. But like an Axe body spray, that's probably the only time that I tried it.
Oh, yeah.
And I just didn't like using it. And
Oh, the chocolate Axe spray.
Chocolate.
It was the chocolate
I
smell.
didn't even know this existed.
Oh, yeah. That was my scent.
You're learning way too much about us today.
Yeah.
But all of these things can have an emotional impact. And that's why we prefaced the conversation the way that we did, is because these things can have a negative impact on your mental health when you start to perceive that there's something wrong with you or that you're not fitting in with your peers in the same way. And so there are ways to remedy some of these problems. But again, understand it doesn't change who you are.
Yeah.
So,
and most likely, the people who may be making fun of you for this type of thing, or the people that you tend to look up to and idolize because they have idealistic looking skin, are probably struggling with similar things.
yes.
And so everybody, we're all in humanity together. We're going through these experiences, and we have very similar experiences, but we like to try to distinguish ourselves one from another. But we're all fighting some sort of battle.
Yeah.
And very often the people that you look up to have fought or are fighting similar battles that you are.
Yeah, that's very well said. Before we get into all the recommendations for a teen skincare routine, let's dive into a little Did You Know?
Yeah. All right, Dr. Portela, did you know that acne affects 85% of teenagers in some form?
Yeah, that is a statistic that I have been familiar with. I was definitely one of the 85% when I was growing up. And I feel like if you didn't get it as a teenager, it's still coming. Like more and more adults are getting acne.
Yeah, I will say I never really struggled with acne, but I still, to this day, I'm 36, get pimples. And so I never had like big breakouts, but I'll get annoying pimples here or there, even to this day.
I still get them once in a while too. I've got the remnants of one here on my forehead.
I know, actually, I think I have an active one.
I had a bigger one on my cheek a couple of weeks ago. I took Accutane when I started to feel that deep one.
Oh, yeah.
Yeah.
And it knocked it down.
Oh, yeah,
Perfect.
right away. So I did 4 months of Accutane when I was a dermatology resident because I just felt like I can't have acne as a dermatologist.
Yeah.
So
there's a stigma.
Yeah, there definitely is a stigma. And I was prescribing it all the time, and I was like, I'll just take this stuff too.
Yeah.
And I would have completed the full course, but I was 4 months into it, and I got notified that I matched on the bone marrow donor registry. And so I had to get off of Accutane in order to donate bone marrow. And I did end up donating bone marrow in 2015. Yeah. So,
that's awesome.
So if you're not registered on the bone marrow donation, I highly encourage you to do that. I've matched 3 times now in my life.
Really?
I've only donated once, but I must have amazing bone marrow to match 3 times. I've never heard of anybody else matching 3 times.
That is kind of wild.
Yeah.
But no, you're helping people.
No, I hope so.
Yeah.
So now I donate blood instead.
That's also a good thing. Yeah. What type are you?
Ooh, can we say that on the podcast?
Can we say that? Is that HIPAA? Is that?
I don't know. I mean, I guess I can say it. So I'm A negative.
A negative.
Yeah.
Okay. I'm O negative.
O negative?
Yeah.
Yeah. So what's the most common? O positive is the most common.
Positive is most common.
Yeah. So now you know our blood type. If you ever see us in an accident, you can tell the first responders, he's A negative.
Get him some blood.
Yeah.
Oh, that's good.
So,
well, hopefully YouTube doesn't take us down for that.
I don't think it will. I think we're in the clear there.
Yeah.
So my did you know is that on average, teenage boys have more severe acne than teenage girls because they have much higher levels of testosterone, and that is the primary driver for acne.
Yeah, I agree.
So,
would you say you see more teenage boys or girls that come into the clinic?
I think it's a mix, but what I will say is I see more teenage girls coming in of their own accord, like they're the ones that encourage their patients or their parents to make the appointment.
Yeah.
Whereas for the teenage boys, more often it's the parents bringing the kid in, like, can you convince him to do something about this?
Yeah, I would agree with that.
So, but I do think more boys are becoming aware and wanting to treat it than maybe 5-10 years ago. And that's probably the result of social media and peer pressure and things.
Yeah.
So
that's not a bad thing.
It's not. That's not a bad thing. Well, there's your Did You Know?
Yeah.
Let's dive into how to build a teenage skincare routine. We can also talk about some of the other problems that we mentioned and how to remedy those.
Yeah. All right. Well, let's start with the big one.
Yeah.
Acne. Mm-hmm. What do you recommend for your teenage patients who are coming in struggling with acne as just a basic skincare routine?
So let's approach this as if it's over the counter because people listening to this, you're not in a dermatology office.
Yep.
So starting with cleansers, we've got cleansers that are specifically for acne. That's going to be things like benzoyl peroxide and salicylic acid. If you're getting a benzoyl peroxide cleanser for the face, go to a lower percentage, like 2.5%, 4%. When you get to higher percentages, the studies have not shown that they're better at treating acne, but they do cause more dryness and irritation.
Yeah.
That goes for the leave-on topical products, like the creams that you leave on the skin with benzoyl peroxide. The lower percentages are generally going to be less irritating, but just as effective as the higher percentages.
Yeah.
Salicylic acid, you can get up to a 2% salicylic acid over the counter, and you can do that in a wash. You can do that in a spot treatment. For some people, a 2% salicylic acid all over the whole face will be kind of irritating.
Yeah,
so you got to be cautious with that. So those are the kind of cleanser categories. You can also get retinol over the counter. There's a retinol that used to be prescription. It's called Differin.
Yeah.
And that is one of my most commonly recommended products through social media about how to treat acne, whether you're an adult or a teenager. Differin is very effective.
Yeah.
You can also use products with niacinamide. It can be helpful for oil production and acne management. And if you have more sensitive skin, you might just use a product like Differin or maybe a spot treatment of benzoyl peroxide and then just have a gentle cleanser.
Yeah.
But don't forget to moisturize. With any of these conditions, you do want to moisturize the skin to help protect that skin barrier from the dryness that the other products might cause.
Yeah, I would totally agree. That's basically exactly how I approach the skincare routine for my teenage patients.
Yep. If you are in a dermatology clinic, you might be given prescription strength retinol. You might be offered in-clinic treatments like light chemical peels, combination creams that mix clindamycin with benzoyl peroxide. There's a lot more options that we have in the dermatology clinic. But by and large, when I approach a patient with acne or I make recommendations through social media, the goal is always to make it as simple as possible for that person.
Yeah.
Rather than giving them 5 or 6 different things to put on, can we do a combination cream that has niacinamide and tretinoin or benzoyl peroxide and clindamycin? In some cases, we can do tretinoin, benzoyl peroxide, and clindamycin in the same compound.
Yeah.
So we want to keep it as simple as possible, especially for teenage boys who are, on average, not to generalize too much, not as good about maintaining a skincare routine.
Yeah. One thing that I typically recommend for mine who struggle with doing the daily things, morning and nights, keeping a routine can be difficult, is I usually mention do not put your products in the drawer because when they're out of sight, they're out of mind. So we need to, if you see them, you're more likely to do them. I know it makes the bathroom counter a little bit more messy, but you're more likely to do things if you see it and go, oh yeah, I'm supposed to be doing that. And
the number of times I've had a parent come in with their teenager, usually a boy, and they're following up for acne and they still have acne. Have you been using the products? And they're like, no, not really.
Yeah.
Like, okay, why don't we try using the products and then follow up? I'm sorry that you had another copay today.
Yep.
For me to tell you to do the same thing I told you to do last time. But I can't make a judgment that it's not the right routine for you if you haven't used it. So I think that's good advice, to keep it on the counter and make sure that you see it so you're more likely to use it.
Yeah.
If you need to, take a rubber band and tie it to your toothpaste, because presumably you're in the habit of brushing your teeth.
Yep.
And then you're picking up the toothpaste and you're like, all right, I'll treat my acne too.
Totally.
So.
Yeah, I have that conversation very often too. And usually it's like the frustrated parent saying, I've told him to do this every time. So now I'm going to bring him into the doctor and have him tell.
Yeah. So teenagers, cut your parents some slack. They're paying a copay. They're buying the prescriptions. They're buying your over-the-counter products. Just use them. Give it a good, honest try. And then if we need to tweak the plan, we definitely can.
Yeah.
So do you think that teenagers need to be using sunscreen?
I 100% think teenagers need to be using sunscreen, especially if they're using a retinol or different acne gel, which do make them sensitive to the sun. But sun strips our barrier, it causes inflammation, and we want to slow down anything that's going to aggravate acne or whatever condition they have going on. And so, yes, I do recommend sunscreen to all my patients, especially ones on acne.
Find a lightweight sunscreen that feels good on the skin. Yeah. And I understand you're probably not going to be reapplying it throughout the day. You're at school. Yeah. Just get it on in the morning before you go out. If you're doing sports after school, have something in your gym bag that you can reapply, because it makes a difference for your skin. You might not see all those benefits now, but 40, 50-year-old you will really appreciate that.
Well, really, thank you. And there are so many good moisturizer sunscreen combos that you could be using that cover both things. So you're getting a 2-in-1 product. So
keeping it simple.
Yep.
When we talk about dandruff, any specific recommendations for teenagers that are suffering from dandruff?
Yeah. So staying with over-the-counter, I almost always recommend a Nizoral shampoo. It's just the ketoconazole 1% shampoo. The key to that is you really need to let it sit for 10, 15 minutes really to get the full effect of it. If you do kind of how I shower, I'll shampoo my hair, let it sit for like 2 seconds, and I'm washing it out. You really need to let it sit. Also, if your scalp is itchy and it's irritated from the dandruff, using something like tea gel can be beneficial. Yeah. We've also talked about in the past the Vichy's selenium sulfide shampoos and other types of selenium sulfide. Selsun Blue can sometimes be beneficial as well. So I'll start with that, and then that's basically what we'll start with. And then if the over-the-counter ketoconazole, Nizorals, and anti-inflammatory shampoos aren't working, definitely come on in, and there's prescription strengths that we can get to you.
Yeah, if you're using an over-the-counter shampoo, I think we've mentioned this on the podcast before, also use the conditioner from the same brand.
Yes, you did mention
It's a very good idea, because it's not going, they should be formulated in a way not to strip off the active ingredient that you just put on your scalp.
Yeah.
So you're going to get better efficacy by using the conditioner from the same brand. If you're getting dandruff that comes down onto your face, or you're getting that tinea versicolor, that summer rash, you can use those shampoos on the body as well. That can be an effective thing. And teenagers are prone to that when they're getting so much oil production.
Yeah.
What about the body odor?
Body odor can be a struggle, but usually the main cause of body odor isn't necessarily the sweat, it's the bacteria that is gobbling up the sweat, and then the byproduct of the bacteria is a bad odor. So there's been a big push for hypochlorous acid. So after the gym, after working out, after playing sports, you can buy these sprays you can spritz onto the armpits or on the body, so that way it kind of neutralizes that. You could also use Hibiclens in the shower, which is something that I actually use. So after I'm working out or after I play pickleball, I will just wash the armpits, the groin, those areas with Hibiclens, just to prevent any bacteria there from flourishing and causing BO. And then antiperspirants can help, like you had mentioned, at nighttime. Yeah. There's always this big push, don't use aluminum. I use aluminum. Yeah. And it does a great job for me. It keeps me from sweating. I'm in the office sometimes under the lights doing procedures or surgeries, and it's hot. And if I don't, I get sweaty.
Yeah. So. Yeah. I'm so far, unconvinced that aluminum is harmful when you're using it in a deodorant form. If evidence really comes out that changes my mind, I'll be honest about that. I've looked at the evidence and so far been unconvinced that antiperspirants with aluminum are truly harmful to most people. So that's good. You also I've seen people using glycolic acid under the armpits, like The Ordinary makes a glycolic acid. You put it on a cotton pad, you can swipe under the armpits. That can help to kill the bacteria.
Totally. Benzoyl
peroxide can be another thing you can wash with. So reducing the bacteria and using, just a deodorant in the morning, antiperspirant at night are all good ideas. If you're still struggling with body odor, then come and see a dermatologist, because we have additional tools that we can use to help reduce sweating if you truly have hyperhidrosis.
Yeah.
So, and that kind of is the theme, is that on all of these, if you've tried these over-the-counter recommendations we've talked about and you're not getting the results that you want, or you have a skin condition that we didn't touch on here that are common for teenagers, certainly come see a dermatologist, and we can work with you to make sure there's a remedy for that.
Yeah, that's exactly right. What are some things to avoid that you talk to your patients about who are struggling with these types of conditions that are out there that can be harmful to their skin?
The first is just be careful with your TikTok trends. There's so many things out there that people are trying to convince you to do. And don't make your decisions for your health based on fear. Because a lot of these things I see people selling on TikTok Shop, they're trying to scare you into something like you need to buy beef tallow because these have hormone disruptors and toxins. And if somebody just says the word toxin, I can immediately brush them off, because if they don't go into the science and explain why something is toxic at this dose, and this is why you need to avoid it, and this is a better alternative. But if you're just throwing out the word toxin, you're just using a buzzword, and it just grinds my gears.
Yeah, so, I would 100% agree.
So be careful with your TikTok trends. Also, if you are committed to a skincare routine, use it for a while. Don't abandon ship after a week or two and say, I need to go buy more products. I need to buy something different. I need to, I saw somebody new using something. I'm going to try this and try this and try this. Keep it simple. Use it consistently for 6 to 8 weeks at a minimum, and then make a determination if you need to change something.
Yeah, that's a good point. I get so many patients coming in overwhelmed with the amount of different products. And when I ask them, well, what's your regimen look like? Well, I tried this for a couple of weeks. It wasn't working. And then I moved to this. And we live in a world where, like you were saying, TikTok, everybody's trying to sell you something. And if you have a routine that's just jumbled with tons of stuff because you're being inundated with ads, we need to cut out a lot of things, simplify, and then stick with it. Yep. And most of the time, you're going to get some benefit from sticking to a routine.
Right. Exactly.
Yeah.
So as we wrap up, we do want to share a couple of products with you today. These are just simple products that work well for teenagers, and these are not gospel by any means. You don't have to have these exact products, but this is just an example that can work well for a teenage skincare routine. First is the La Roche-Posay Toleriane Purifying Foaming Cleanser. So this is going to be better for somebody who's a little more oily skin, maybe a little bit of acne, but this foaming cleanser is going to remove excess oil from the skin. It's still very gentle. We have the Differin gel here. This is the over-the-counter true retinol that used to be available by prescription. It's very reasonably priced, so it's going to last you a long time. And then my favorite sunscreen, Elta MD UV Clear. It's clear because it's made for acne-prone skin. It's the niacinamide. It's not because it goes on invisible, although it does.
Yeah.
It's a very good sunscreen for oily and acne-prone skin because of the niacinamide in there. So 3 products that I love, that I personally use, that I recommend. I don't know if you have any others you want to chime in on, or
to be honest, I use Differin on occasion. That is my favorite sunscreen for sure, and I have used that La Roche-Posay face wash, and I've liked all those products. I think they're great recommendations.
If you need more nuanced suggestions for a specific thing, we'll try to do our best if you send us a message at skinfluence_pod on Instagram. And we're going to be announcing that we're doing monthly giveaways of skincare. Our first one is going to be huge. We've got a huge, to-go travel bag full of skincare. I put it all together yesterday.
Love it.
There's probably $500 worth of skincare in there. So once you listen to this episode, take a screenshot on your phone, post it on your Instagram stories, tag Skinfluence Pod, Austin Lee PAC, and Dr. Dustin Portela. Make sure that you're following us so that we can see those, and we will pick a winner and give away $500 worth of skincare. and we've got plenty more where that came from. So let us know that you're listening to the episodes, and we're going to reward one of you.
Yeah. And like you were saying, reach out to us, ask us questions. We do try to respond to the questions that we see in the comments, and sometimes you need a little bit of a tailored suggestion, and we're happy to give that where we can.
Absolutely. Thanks for tuning into this episode of Skinfluence. You can find me on social media at Dr. Dustin Portela on all social media platforms.
And you can find me at Austin Lee, Leepac.
Take a moment and give us a 5-star review wherever you listen to podcasts, and we'll catch you guys on the next episode.